Dr. Eboni Lance is the Associate Director of Neurology and Neurogenetics at the Kennedy Krieger Institute, a neurologist and medical director of Sickle Cell Neurodevelopmental Clinic and assistant professor in the Department of Neurology and Pediatrics at Johns Hopkins School of Medicine. Dr. Lance received her undergraduate degree from Princeton University and received her medical degree from the Medical University of South Carolina. She did residency in general pediatrics at Children's Hospital Los Angeles and additional specialized residency training in neurodevelopmental disabilities at Kennedy Krieger Institute. She received additional research training at Kennedy Krieger Institute, Johns Hopkins University School of Medicine, and has a PhD in clinical investigation from Johns Hopkins Bloomberg School of Public Health. Dr. Lance is board certified in general pediatrics, neurology, with a special qualification in child neurology and neurodevelopmental disabilities. Her research interests is in children with sickle cell disease and neurodevelopmental issues such as ADHD, intellectual disability, and learning disabilities.
All right. Yes, thank you very much for the invitation to speak and for that introduction.
Sure.
Very appreciated. I will go ahead and share my presentation.
Yeah.
All right, there we go. So yes, I am going to be talking today about cognitive functioning in sickle cell disease with really a focus on executive functioning. And I look forward to a lively Q&A afterwards. These are my disclosures. I don't have any relevant financial relationships, but I have consulted for Novartis in the past, and I will not be discussing anything unapproved or investigative today. So I am hopeful that we will be able to talk about common forms of brain injury in sickle cell disease, discuss executive function, and identify why it's important in general pediatric and adult development, as well as in sickle cell disease. And then talking about strategies to improve executive function. So again, my training is in neurodevelopmental disabilities, and that involves the treatment, the evaluation, diagnosis, and treatment of neurodevelopmental disorders. And these are the neurodevelopmental disorders in general. And so I have a general pediatric practice where I see patients with these disorders. And then I have a secondary clinic just for children with sickle cell disease with these disorders as well. So you may be wondering what these disorders have to do with sickle cell disease, and that's what we'll talk about today. So there are different types of brain injury in sickle cell disease. As you can see here at the top of the pyramid is overt stroke, which is basically strokes that involve large blood vessels in the brain and that are associated with the typical symptoms that we hear with stroke, and that can be weakness of one side of the body, drooping of one side of the face, difficulty with speaking or being understood. And due to new practices in the management of sickle cell disease, the incidence of overt stroke has decreased, but it is still one of the more devastating injuries in sickle cell disease. Now, right below that, we have what is called silent cerebral infarction. Some people call it silent stroke, and that's actually the most common neurological complication in sickle cell disease today. It happens in over 1/3 of patients with sickle cell disease by the time they reach adulthood. So silent cerebral infarction typically involves smaller blood vessels of the brain, and it typically targets the frontal and central parts of the brain. And it's called silent because you don't see those big symptoms that I just talked about that you see with overt stroke. So you don't see the weakness, you don't see the facial droop, you don't see the speech difficulties, and because it's these really small lesions. What you can see is after they've happened, people can have difficulties with attention, with memory, and with executive function, which again, we'll talk more and more about. The other thing about silent cerebral infarctions is once you have one, you're at increased risk for having more, and it also puts you at an increased risk for having an overt stroke. So really, it's very common but it's also something that can put you at increased risk for other injuries. And then I'll go to the bottom of the pyramid to what I look at and what I see most commonly in my clinic for children with sickle cell disease, and that's children with school problems and cognitive dysfunction. And we think that that's happening due to suboptimal oxygenation from the disease process itself. So the anemia part of sickle cell disease, which is basically saying that not enough blood is getting to the brain on a regular basis. And so that may be leading to some of these difficulties that we're seeing in these patients. So I also wanted to reiterate about silent cerebral infarct or silent stroke. So again, you can see on this slide that even in children as young as 2, that we can see these silent strokes in those children. By the age of 6, they're usually above 25% of people with SS type sickle cell disease can have a silent cerebral infarct. And then ongoing into adulthood, where after age 30, it can be upwards of 50%. And again, I already told you that these lesions target the frontal and central lobes of the brain, which is why the symptoms that they cause are so important. In addition to thinking about brain injury in the context of cognition and sickle cell disease, you also have to think about the things that we know impact cognition overall. So things that impact child development. And one of those factors can be socioeconomic status. And one measure of socioeconomic status is actually parent education levels. So you can see from this slide, this is the study of children ages 5 to 15 with sickle cell disease studied over a long period of time. And you can see that they're separated by their IQ scores here. And you can see that the children with the highest IQ scores don't have a history of brain injury, and their parents have some college education or more. And then the children with the lowest IQ scores also, so they have a history of a brain injury, they have a stroke or an infarct, and their parents have a high school education or less. So again, this is a study for children with sickle cell disease, but we know that parent education level can impact child development in anyone, any child. But the other thing to note about this slide is that in all of these groups, the IQ seems to be going down over time. So that's regardless of brain injury status, and that's regardless of parent education level. And that really is because of the disease process itself, again, because of the anemia part of sickle cell disease and how that impacts the brain. Now, in addition to these studies and these tests that we do, it's also important to listen to what parents are saying about their children. And so this was a study using data from the National Health Interview Survey, which is basically parent surveys about their children across the United States. And so they compared a few different things in children, Black children with sickle cell disease, and compared Black children without sickle cell disease in the same survey to look at the answers. And what they saw was that parents of children with sickle cell disease reported their children having more issues with learning disabilities, with intellectual disability, which is the new term for mental retardation, and then with other developmental delays as well. And so parents are seeing these difficulties in their children too, and they're reporting them. And these were all significantly higher than what was reported by parents in Black children without sickle cell disease, which is the comparison group here. In addition to children, I also want to make sure that we talk about adults a little bit here. Even though I don't treat adults, there is a lot of literature out there on adults with sickle cell disease and cognitive issues. So this was actually a study of neurologically intact adults with sickle cell disease. So these were adults who had no prior history of stroke, who had normal neurological examinations, so normal physical examinations, and they had normal MRIs. And they compared these adult patients to other adults in the same community, so who living in the same area, and they did cognitive testing. And what they found was that the neurologically intact adults, so again, they had no stroke, no silent cerebral infarct, normal imaging, did have lower scores in their performance IQ, their perceptual organization index, working memory, and processing speed. And again, what this means is performance IQ is how they kind of perform on tests. Working memory is your ability to keep something in your brain and kind of think about it over time in the background. And processing speed is just how quickly you're able to respond to things and correctly. And you can see that processing speed was actually the one that was most affected in these patients. So again, even in adult patients who haven't had neurological complications, we still see some effect of the disease process in their cognitive status. So a few years ago in our clinic, we actually took a look at what neurodevelopmental disorders we were seeing most commonly in our sickle cell disease patients. And at that point in time, the most common diagnoses we were seeing were ADHD and developmental delays. And that was followed by children with attention issues. So children who did not actually have ADHD, like they didn't meet full criteria, but they did have some issues with attention. And then children with specific learning disabilities in math, reading, and reading comprehension. As you can see at the other end, we also had not seen any children with autism spectrum disorder and sickle cell disease at this point in time. And that's something that remains a bit of a mystery to us that we're starting to study more and more. Now, this past year, this year, we actually published an updated look at these diagnoses. And so what we did here is we looked at all of the children in the Pediatric Hematology Sickle Cell Disease Clinic at Johns Hopkins, where we get most of our referrals. And we looked at the rates of neurodevelopmental disorders in that clinic group. So that is the line here in black, where we looked at the rates of these disorders. Right next to it is actually the rate of these disorders in children in general in the United States, so a comparison group. And then this line is the rate of these disorders in Black children in the United States, and then the rate in Hispanic children in the United States. And so you can see here that in our clinic, in the Hopkins Pediatric Hematology Clinic, most of the patients are Black. So the most comparable line would actually be this Black children line here. And you can see here that the rates in the clinic for these disorders are lower than the rates in the general population. So that's true here for language disorders, and that's also true here for ADHD, which are the most common disorders. And this is something that we didn't actually expect to see. We thought that the rates of neurodevelopmental disorders would be more in the sickle cell group, and that's because of the risk of brain injury in those patients causing increased risk for these disorders. And then in addition to that, some children have neurodevelopmental disorders and don't have brain injury, right? It may run in their family, or they may just have it and there's not really an explanation for why. But we were expecting to see more. And so this was really concerning to us because given that this is the primary population that we serve, we're worried that we're missing these disorders in our patients, and also that we may not be screening properly in these patients as well. So I want to talk more about executive function because this is really something that a lot of people struggle with, and I want to make sure that we all know what executive function is. So this is some information from the Center on the Developing Child at Harvard, where they talk about executive function referring to a set of skills that underlie our capacity to plan ahead and meet goals, display self-control, follow multiple step directions even when interrupted, and stay focused despite distractions. And really, executive function helps our brain prioritize tasks, filter distractions, and control impulses. You're not born with executive function skills, but everyone can learn them. And so basically, as children, we learn from birth about executive function just by paying attention, learning to pay attention. So when someone's talking to us, learning to pay attention, something as simple as playing a game with a baby can help build executive function skills, the early foundations of memory and self-control. And then as children get older, adults really set up the framework for them to learn and practice these skills over time. And so that we can help them by establishing routines, breaking up big tasks into smaller chunks, playing with them, teaching them about following the rules, giving them chores is a big thing that can be a part of teaching them executive function. And really, we're just trying to build this scaffolding, build this foundation to help them until their executive function skills emerge and they can perform a lot of these tasks on their own. So this is something that benefits everyone. As the child grows into adolescence, this lets them plan and act in a way that makes them good students and good friends. And in turn, that helps them grow into adults capable of juggling multiple commitments, which I will just lump into the general term of adulting. But basically, it helps them with adulting. And so the more that we invest in building up this executive function over time, the more that we help our children prepare to be adults and to function independently in the world. Now, there are some other definitions of executive function. This one comes from understood.org, which is a good government-based website where they talk about a lot of the neurodevelopmental disorders. This breaks executive function down into 3 parts: working memory, or being able to keep information in your mind and use it in some way; cognitive flexibility, which is also known as flexible thinking, so being able to think about something in more than one way; and inhibitory control or self-control, which is being able to ignore distractions and resist temptations. And executive function is actually responsible for a number of skills, and that includes paying attention, organizing and planning, initiating tasks and staying focused on them, regulating emotions, and self-monitoring. And so it's really, really important because it kind of underlies a lot of what we do. And this is from actually an ADHD website, chad.org, because executive function is actually is a big problem in ADHD, particularly in adolescence. And so they provide a definition that is just that it refers to brain functions that activate, organize, integrate, and manage other functions, enabling us to account for short and long-term consequences of our actions and to plan for those results, but also allowing us to make adjustments if necessary if our actions aren't achieving the desired result. So again, just 3 different, slightly different definitions, but all kind of saying the same thing. And in case you're not convinced by these definitions of how important executive function is, there have been different studies looking at different aspects of life and how they're impacted by executive function. So first of all, in mental health, executive function is impaired in a lot of mental health disorders, including addiction, ADHD, as I already mentioned, conduct disorder, depression, obsessive compulsive disorder, and schizophrenia. So all of these disorders can have impaired executive function. Executive function can also impact physical health. So poor executive function can be associated with obesity, overeating, substance abuse, and poor treatment adherence. People with better executive function also have a higher quality of life. And executive function is actually more important for children for school readiness and for math and reading competence throughout the school years than IQ or entry-level reading or math skills. So that's really big, that executive function can impact your learning more than what you already know. Executive function in adults can also affect job success, so it can lead to poor productivity and difficulty finding and keeping a job. Marital harmony in adults, so a partner with poor executive function can be more difficult to get along with, less dependable, and more likely to act on impulse. And while I'm happy to answer questions about adults, if you're side-eyeing your partner right now, try not to do that. We'll get to some strategies for you. And then public safety. So poor executive function can lead to some social problems, including crime, reckless behavior, violence, and emotional outbursts. So really, again, I just want to stress that this is something that's important to every aspect of life in general, so in the general population. And so that's all well and good, but what does this have to do with sickle cell disease? Well, executive function is primarily housed in the frontal lobe of the brain. So that's where we do thinking, planning, organizing, and problem solving, and emotional and behavioral control, all of which are made up to make up executive function. And if you remember, I told you that the frontal lobe of the brain was targeted in sickle cell disease. And so this is a study, this was a natural history study of sickle cell disease, a cooperative study of sickle cell disease, I think performed back in the 80s to 90s. What they saw here was when they looked at patients who had a history of a silent infarct, 81% of those patients had silent infarcts in the frontal lobe of the brain. And then in patients who had a prior stroke, so this is the overt stroke, 94 of those patients had stroke in the frontal lobe of the brain, again, which houses executive function. And then these were smaller studies with 58 and 18 patients. But here's a larger study from the Silent Cerebral Infarct Multicenter Clinical Trial, where they looked at almost 300 patients with sickle cell disease. And the patients with all had silent cerebral infarct. And so when they looked at these patients, 90% of these patients had infarcts in the frontal lobe of the brain, 90%. So again, the frontal lobe is really targeted in sickle cell disease, and that's why executive function is so common in sickle cell disease. So I want to talk a little bit more about what executive function might impact in sickle cell disease, and I'll try to I'm going to start with some general things and then get more specific as we go. So this is one study where they actually looked at inhibitory control in children with frontal infarcts. So these are children with strokes and sickle cell disease, and they basically looked at their inhibitory control. So they did a test where they had them responding to a stimulus, and then they switched up the stimulus they were responding to, and saw how well the children were able to inhibit their responses when they switched up the task. And what they found was that children with frontal infarcts had more accuracy errors in this inhibitory testing than the control group. And so this suggests that, again, frontal lobe injury can impact inhibitory control, which again is part of executive function. This was a study where they actually looked at transcranial Doppler ultrasounds and executive function in children with sickle cell disease. And so they compared children with abnormal transcranial Dopplers, which transcranial Dopplers are a test that you can do to assess stroke risk in patients with certain types of sickle cell disease. And so if you have an abnormal transcranial Doppler, it means that your blood is flowing very quickly in your brain and that you're at higher risk for stroke. If you have a conditional transcranial Doppler, it's higher than normal, and you have a higher risk for stroke, but it may not be as high as the abnormal group. And then normal transcranial Dopplers mean your risk for stroke is lower. The blood flow in your brain is flowing slower or more normally. And so what they found was that children with abnormal transcranial Doppler values, parents reported that they had more difficulties with inhibitory control and emotional control than children with conditional transcranial Dopplers. And then teachers also were a part of this study, and they noted that children in the abnormal transcranial Doppler group had more difficulty with metacognitive skills. So specifically difficulties with self-monitoring, difficulties with problem solving, working memory, planning, and organizing relative to the conditional group and the normal TCD group. So we're even seeing difficulties in executive function in patients who have abnormal transcranial Dopplers, putting them at risk for stroke, but who may not have had a stroke yet. So there have also been studies looking at executive function over the lifespan in sickle cell disease. This was a smaller study, but they looked at infants who were 9 and 12 months old with and without sickle cell disease. They didn't see any performance differences in executive function between the groups, but they did note that sickle cell babies showed improvement in tasks between 9 to 12 months of age. And so that was a very positive finding, that the disease process may not be affecting the brain significantly at this point in time. So another study looked at, or two studies actually looked at executive function in preschool children with sickle cell disease. One study noted that there were some deficits in inhibitory control and cognitive flexibility in the preschool children with sickle cell disease. And another study noted that the children with sickle cell disease needed more support in order to shift focus and stay on tasks. So when you're transitioning from one task to another, in comparison to children without sickle cell disease. And so this is important because there are supports that these children can have in school to kind of help with this, so that they can keep up with everyone else. Another study looked at more at school-age children with sickle cell disease and actually looked at their performance on an executive function task. And what this study found was that children with sickle cell disease had lower scores on these tasks that involved organization, task initiation, and task completion. And they also had lower scores on the parent and teacher rating scales for executive function in general. And so this shows that it's not just parent report and teacher report, it's also tasks that involve executive function can impact these older children with sickle cell disease. Another study noted that executive function can actually impact working memory and processing speed. So they did a study where they noted that children with sickle cell disease had more difficulties than a comparison group in their working memory, executive function, and processing speed. What they found was that executive function seemed to control the relationship between sickle cell disease and working memory. So executive function was what was kind of affecting why they were having memory difficulties. They did not see that with processing speed, just with executive function. So again, there are remediation strategies. There's strategies that can focus on executive function that may be helpful with working memory deficits in sickle cell disease. And then this was another study where they actually looked at verbal abilities and executive function in children with sickle cell disease. And what they found was that there were significant differences between sickle cell patients and controls in inhibition, in planning, and in verbal fluency. And they found that the, how do I say this? They found that the inhibition skills, so the executive function difficulties, accounted for the differences in the performance of these children with sickle cell disease. So again, executive function is influencing how they're performing on these tasks. So I wanted to go back to this slide to again stress to you that executive function can be important to just about every aspect of life. And there have been studies looking at some of these aspects in sickle cell disease as well. So this study actually looked at sleep and executive function in patients with sickle cell disease. And what they found was that while you're sleeping, your overnight oxygen saturation levels and your amount of sleep arousals can impact your executive function. So in this first graph, the number of times you wake up, your arousal index is down here. And then this is your executive function score, higher is better. So the more times that you wake up during the night, the lower that your executive function performance will be on this test. In addition, the higher oxygenation levels that you have while you're sleeping, the higher executive function scores that you'll get on this test. And so sleep is something that's can clearly impact executive function. And so it's important to talk about and assess sleep in patients with sickle cell disease, as this could be something impacting cognition. Social skills can also be impacted by executive function. And again, we see this in the general population, but this is a specific study looking at sickle cell disease, where they found that poor executive function scores, as reported by the child and the parent, were also associated with poor social skills, again, reported by the child and the parent. So again, we're seeing here that executive function can impact your social skills and thus your relationships with other people. Quality of life. And quality of life is something that's really important in the general population, but especially so in sickle cell disease, because quality of life can really impact your outcomes. And obviously it's important for personal reasons too. So what they found in one study was actually that pain, executive function, and coping strategies were all affected by each other. And so they saw that patients who had more emotion-focused coping strategies with their pain, so things like internalizing their feelings, catastrophizing their feelings, or externalizing their feelings, which is more like blaming others for their problems, that associated with pain and executive dysfunction predicted a poor health-related quality of life in these patients. So again, there are healthier coping strategies to use with pain, but somehow having executive dysfunction can impact the coping strategies that you use to help with pain. And another study found that executive function can predict parent and child reported quality of life for children with sickle cell disease as well. So really getting down to it, it's really important in several aspects. This was a study where they actually looked at executive function over the lifespan, as well as in patients with different brain injury statuses. So in this top table, they compared different cognitive domains in patients who are preschool age versus school age. And you can see there are significant differences actually in all of these domains except processing speed, and that there's definitely a difference here in executive function, where the school-age children have worsening executive function than the preschool-age children. You don't see that difference in school-age and adult patients actually for executive function, but you still see it for full-scale IQ, verbal reasoning, and perceptual reasoning. And then you do see it when you look at adults versus preschool children. You again see that difference in executive functioning. In addition, if you go down here and you look at the different types of brain injury, so you see differences, you don't see differences in executive function between patients with no infarcts and silent cerebral infarcts, but you do see the other domains, cognitive domains being affected here. You do see a difference between patients with silent cerebral infarct and stroke in executive function, where the patients with stroke have worsening executive function. And then you also see a relationship in patients with stroke and no stroke, where the patients with stroke have higher or have poorer executive function. So I think that you have an idea of what executive function is. You have an idea of why it's important in general and why it's important in sickle cell disease. And you have an idea of how sickle cell disease can impact executive function and how executive function can impact sickle cell disease. So now I want to turn to some strategies that you can do to help improve your or your child's executive function. So there's a lot of books out there, a lot of resources out there talking about executive function. These are a few of the books that I've found. The ones highlighted in green up here and here are ones that I've actually read and found to be helpful. These ones down here I've found, but I haven't actually read. And then I did want to include at least one resource for adults. So again, even though I don't treat adults, this is at least one resource. I can tell you that the internet also has a lot of resources, but these are resources that I've vetted along with some of the websites that I presented earlier in the presentation that may be helpful for you. The first thing, though, with helping with executive function is actually getting a diagnosis of executive dysfunction. And the best way to get a diagnosis is really to have psychological testing or neuropsychological testing. So that includes cognitive testing as well as testing for mood. It can also include academic testing as well as developmental testing. And so there are some gold standards for measuring or diagnosing executive function, but I just wanted to point out one scale that specifically is for sickle cell disease. Now, this is not the gold standard for diagnosing executive function in sickle cell disease, but I think it does give some very good examples of things that might be impacted in executive function if you have executive dysfunction and you have sickle cell disease. So they talk about it under a few headings: initiation of routines, which is taking your daily medications, getting out of bed on time, personal hygiene on time, finishing your chores, keeping your room clean, and finishing homework. Some of these are related to sickle cell disease and some are not. Perspective memory deficits, so taking your temperature, managing mild or severe pain, avoiding pain triggers, staying hydrated, contacting a medical professional in an emergency, arranging transportation and writing scheduled appointments down. And then providing accurate medical information at your visits, contacting friends and spending time with friends are some other ways that executive function might present and might be important to note for diagnosis. Now, some strategies that have been shown to be effective for executive function in the general population. There are a few different things that are out there. Aerobic exercise has actually been fairly widely studied and has definitely shown that it impacts executive function in a positive way. However, the best way for aerobic exercise to have impact is to have sustained aerobic exercise. So not just exercising one time right before a big test to give your executive function a boost, but really exercising over time for extended periods of time as tolerated. And that can be really any level of exercise that you're doing regularly, although these studies did find that the more exercise you did, the more certain things improved. So these are primarily studies in children that we're citing, but aerobic exercise really can work for anyone with their executive function. Another strategy is actually martial arts and mindfulness practices. So traditional martial arts actually emphasize self-control, discipline, or inhibitory control and character development. There have been some studies looking at Taekwondo training and actually found improvements in cognitive and emotional control and executive function. And this is not just something that they saw in these children when they were doing the martial arts. These skills actually generalized to school, to home, to other contexts, and also were found on multiple different measures of executive function. So this is something that really works, that works broadly, and that children are able to use in their life skills when they do it in their martial arts training. The gains for this particular study were greatest for the older children and the least for the younger children, and greater for boys than for girls. But again, martial arts is something that I recommend for a lot of my patients with ADHD because it really does seem to help with executive function. It's important to do martial arts training that includes a mindfulness component, though. The mindfulness component is probably the biggest factor here. So speaking of mindfulness, there is some suggestions in some studies that yoga might be helpful for executive function as well. This was a study where older girls were randomly assigned to yoga or physical training, and yoga training seemed to improve executive function, with the improvements most evident in the patients with the most severe executive dysfunction. So this again was physical training, relaxation, and sensory awareness. So there's a mindfulness component that's necessary here, but it is something that has shown some improvement. Now, I also found that there was a randomized trial of yoga for children hospitalized with pain crises and sickle cell disease. And since then, there's been another study, I think, that actually, the other study, I think, was published within the last 2 years. And in that study, they didn't see improvements, but really it was because they had trouble recruiting patients. And that's something that's a bit sad, right? Because we have this one study that shows that yoga actually is helpful for hospitalized children with pain crises, that it reduces their mean pain. We didn't see differences in their length of stay or their opioid use, but it seemed to improve their pain scores, which is important. Unfortunately, because this other study, they couldn't recruit enough patients to do the study, we don't have evidence, more evidence for this in order to more highly recommend it. And so that really speaks to the need for patients to participate in studies, particularly studies that may have interventions that are useful for them or helpful for them, like these alternative therapies, treatments. So this was a study that was more specific to executive function strategies for sickle cell disease. This is a study where they actually did cognitive testing in patients right before their transfusions and right after their transfusions. And so they wanted to see if transfusions impacted the cognitive testing. And what they found was that there wasn't a significant impact of transfusions in the general cognitive testing, but when they looked specifically at the executive abilities, the executive function testing, they did see improvements in executive function in patients after they got the transfusion. So this does not mean that if you have executive dysfunction that you should get transfusions. It just means that if you're getting transfusions for other medical indications, that executive function might be given a boost by this. And it also shows that transfusions really seem to target that frontal lobe of the brain, that area of the brain that is most at risk for stroke and for cerebral infarct and brain injury, that somehow it's really targeting that area and thus boosting your executive function. Another strategy that's actually quite common is computer training. So I know that a lot of you have probably seen these brain games and these other computer training games that say that they can boost your productivity, boost your IQ, things like that. And so this was a study done in patients with sickle cell disease where they did one of these computer training games called CogMed with patients. And what they saw was they did see improvements in specific areas of executive function. And so the specific areas were working memory primarily. So recall, I think they also saw some improvements in some visuospatial areas as well. But they only saw the improvements in the patients that stuck with the computer training program. So this was not a one and done thing. The patients who didn't complete the program didn't show improvements, but the patients who continued with the program and were able to complete it over time did show improvements in these areas, in visual spatial awareness and in working memory. So I still want to give some caveats about these computer training games, right? So again, this study specifically looked at CogMed, which is a computerized memory training program. So it did not look at some of these newer, fancier apps that are out there or games that are out there. What the literature has shown in general with these computerized and interactive games is that they can help with things like task switching. They continuously increase demands, and so that's how they kind of train your brain to do better. But we don't always see generalizable skills from these games. So you may be playing the game and getting better at the game and getting faster at the game and improving your skills at the game, but we don't see that outside of the game. We don't necessarily see improvements in general executive function outside of the game. However, the key to this is repeated practice. The key to seeing any improvements at all is repeated practice. And so this is something that's still under review and something to be explored, but I just want to be clear on those caveats for this. This is the neuropsychologist that I work with, Dr. Alicia Cannon, and she has some specific strategies for school that she recommends for all of our patients with sickle cell disease and with ADHD and in general. So the school could provide minimize, and the parents can actually implement this at home as well. And again, adults can also implement this into their own lives, but really having a workspace where you can minimize distractions and provide consistency and structure to the day, allowing regular breaks from structured activity. So there are apps that can actually kind of do timers where you work for 15 minutes and then take a break for 5 minutes. So that's kind of regular breaks. Providing prompts as needed to redirect to help you stay focused and on task, giving the child gentle corrective feedback instead of more harsh feedback can be helpful. Providing subtle prompts, so possibly just kind of touching their arm or their shoulder to help them stay on track. Ensuring that you have the child's attention before giving instructions. So this is really important. Make sure you have their full attention, they're looking at you, they're listening to you, and then making sure they understand those instructions. So making sure they can repeat it back and they know that what you expect to get done. And then most importantly, prompting the child to check their work before turning it in. So a lot of times people, particularly people with ADHD or executive dysfunction, may rush through their work to just get it done. And so prompting them to check it before they turn it in can make them kind of slow down and go back through it in general. So these are a few of the strategies for executive function that might be useful for you or for your child with sickle cell disease and executive function difficulties. And I just want to say thank you to the patients and the families who inspire this research and also that participate in our clinical research program here in Baltimore. And I think that we have met all of the objectives for the talk today, and it looks like we are close to on time. So I will stop here and just say this work wouldn't be possible without a team of people and also without some funding. And so thank you very much for your time today. And I am happy to take any questions. Let me stop sharing. Right.
Kile, can you go ahead with the questions? I will just go until she comes on. I'll just go with a couple that I saw in the Q&A. All right. So one person asked, how can issues related to silent stroke be reversed, and can stroke happen in trait also?
Yes. So that's a great question. I'll start with the first part. So issues relating to silent stroke, I would not say reversed. I would say that they can. You can work on improving them, certainly. The deficits in attention and memory and executive function, you can work on improving them using different strategies. But what we also recommend for children with disabilities is to actually work around them. So in this day and age, there's a lot of tools that you can use to remind you about things. So you can use your phone and set reminders. I myself have several reminders on my phone to keep me on time and keep me on task for things. You can have apps. There are apps for children that can help them with their routines. And so that can help with children who have executive function issues in terms of sticking to a routine. So you can set up an app for them on a device where it helps them kind of get through their morning hygiene. So like brushing their teeth, washing their face, getting dressed. There are apps that are set up to do that. You can also, again, have accommodations, and this applies to students at all levels. A lot of schools may have accommodations for people with like ADHD that might be applicable here as well, so that they can have some supports in terms of having things repeated for them, getting some tutoring, being allowed to have the teacher's notes or have someone scribe notes for them. These are the ways that you can work around some of these deficits and still be successful. And then the other question of, can stroke happen in trait also? So stroke can happen in anyone with or without sickle cell disease. So that includes people with trait. It's just less common in the general population and much less common in trait as well. However, silent stroke is something that can happen in anyone, particularly if you have like if you have a sudden drop in your hemoglobin levels, so a sudden anemia, anyone can have a silent stroke if that happens to them.
All right, the next question from the same person, neurodevelopment, hearing or seeing is mentioned. Does meningitis affect hearing? How is eyesight generally affected?
All right, another good question. So let's see, hearing and seeing can be impacted by sickle cell disease. We're actually looking at this now, but there have been several studies reporting some hearing loss in children and adults with sickle cell disease. It's not very common, but it's common enough that we should be looking for it. Vision deficits are primarily probably affecting the retina. So that's why people with sickle cell disease need screening for retinopathy. Once they reach a certain age, they should be receiving that screening regularly. Meningitis can certainly affect hearing and eyesight. So meningitis is an infection of the brain, and it can certainly affect those things. But I think meningitis is more an infection that can irritate the brain. And so the long-term effects of meningitis more commonly, I think, are things like seizures and learning, actually. So I'm not certain that hearing and eyesight are commonly affected by meningitis, although I'm sure they can be. It's more, you can have seizures after having meningitis or while having meningitis, and you may have some cognitive difficulties after having meningitis.
Okay, someone else, are these study results transferable to different areas of the globe?
Great question. So yes, these study results are transferable to different parts of the globe. What I would say is that in the US, a lot of these studies have been done in the US and in England and in France, to be honest. So they do have there are some studies with international findings and repercussions, and it certainly is something that is translatable globally. Because I live and work in Baltimore, a lot of the studies that I look at are more related to the United States, but is certainly applicable to different types of sickle cell disease and to different global locations for sickle cell disease. But that's a great question. And I know that there is ongoing research in different parts of the world looking at this. And so hopefully that will continue.
Okay. Someone else, how do you prevent a child from getting a second stroke?
So this is a great question. I want to be clear, I'm not a hematologist. And so you are going to want to talk to your child's hematologist about this. However, there has been at least one study showing that once you have a silent infarct, you have that increased risk for having another one. and transfusions may be helpful to prevent a second silent cerebral infarct, or no, a second stroke, really. However, the evidence on this is limited for silent cerebral infarct. For stroke recurrence, there is definitive evidence that transfusions can prevent a second stroke for sure. The other thing is that hydroxyurea is probably the other most widely used disease-modifying therapy. And unfortunately, there hasn't been great evidence on hydroxyurea preventing additional strokes, but there is a lot of anecdotal evidence. There is some evidence that it decreases your stroke risk, I would say. And so if you go on hydroxyurea, if you've got elevated transcranial Dopplers, you've gotten transfusions to bring those transcranial Dopplers down, and then you get switched over to hydroxyurea, that may still keep your transcranial Dopplers low enough to prevent you from having an increased risk of a secondary stroke. But in terms of preventing it once you've already had one, transfusions remains, I think, the mainstay of treatment there, as well as obviously curative therapies as well.
Okay. Someone asked if you or anyone in your family live with SCD.
That is a great question. So no one in my family directly that I know, except for my brother-in-law. He actually lives with sickle cell disease. I grew up in South Carolina. A lot of my family is in South Carolina. So my first experiences with sickle cell disease were in South Carolina. We have limited resources there as well. So actually, when I was in medical school in South Carolina, there was one provider who took care of children with sickle cell disease for the entire state. So she drove around the state seeing patients, very dedicated provider, Dr. Jackson. She's part of my inspiration for this work. And she actually happened to take care of my brother-in-law when he was a child as well. And so, no, I do not have sickle cell disease myself. I certainly work with a lot of families and know a lot of families who do struggle with this and have some limited personal experience as well.
All right. So someone else, I had a TIA in 2018. Since then, I find myself getting short-term, forgetting short-term information. Is it a result of executive function or dysfunction?
So that's a good question as well. So a TIA is a transient ischemic attack that in some cases can be a precursor or a warning for stroke. TIAs are supposed to have very short, so transient is the key part of that. They're supposed to have very short, limited symptoms. So your symptoms are basically supposed to go away within a short period of time. So if you are having continual difficulties with memory since that, you may have actually had a stroke, not a TIA, or a silent cerebral infarct. Depending on where the location of that stroke or silent cerebral infarct, that certainly could be responsible for your difficulties with memory or attention as well. So your problems with memory may be related to attention. So making sure that you're paying attention when you're receiving information is important, but it could also be an issue with memory. And both of those are associated with the frontal lobe of the brain. And so if that's where your stroke or silent infarct occurred, then certainly that could be a lasting consequence of that. And what I would recommend is getting some updated imaging to possibly see if there is any sign of past brain injury in those locations. But again, talking to your doctor about that. Okay.
So what I'm going to do, I'm going to open the floor for persons to ask questions. So you can raise your hand if you have a question, or we'll allow you to ask a question on camera. But in the meantime, I have a few questions here that I received before. All right. So the first is, why do strokes appear to be more common in younger patients?
So that's a really good question. So it's tough to say, right? If you remember, I showed that slide where you could see the increase in silent cerebral infarcts over the lifespan. And those are people having their first silent stroke, their first silent cerebral infarct. And you can see that the rates of it were higher in the adults. So 50% of adults have had one by the time they reach, I think it was 30 years of age. In younger children, in younger children, the rates are certainly higher than in the general population, but I think the risk factors are very similar in younger patients as in adult patients. And so I guess the only other thing I can think of is physiologically speaking, children may be at risk for bigger hits because it may take us longer to notice when a child is sick because they can't always tell us, right? So it may take us longer to pick up on the fact that they're dehydrated or that they're really sick and need to go to the hospital. In the same way, it also takes us longer to diagnose them with a stroke or with a silent cerebral infarct because children can't always communicate as well that something is going on, that something is wrong. And so a lot of times for the silent infarcts, we have to wait until we see that the child has entered school and is having some problems. And that's really unfortunate. A lot of the work that we're doing now is to try to diagnose these things earlier and better in children. And the other part of it is getting kind of baseline cognitive testing in patients so that if they start having problems, we know what they were like before, and we can see if there's any new deficits that have arisen that may indicate that we need to do imaging to look for brain injury, or even possibly change up their management of their cognitive rehabilitation or management of their sickle cell disease to better protect their brain.
Okay. I think you might have somewhat answered this question with executive function, but the question is, what are the long-term implications of silent infarcts on the lives of patients?
Again, great question. So it really depends on the location of the silent cerebral infarct. Some patients can have silent cerebral infarcts and have no symptoms at all, okay? So they may not have these deficits that we're talking about. Some patients may have very subtle deficits, and in those cases, a lot of times they come up with, again, strategies or workarounds in order to be able to live their lives and to be productive. Other patients with larger brain injuries or more deficits may have more difficulties, and in those cases, we recommend cognitive rehabilitation strategies. So these can be things like physical therapy. For example, if you've had a larger stroke and you have some actual physical impairments, then you may need to do some physical therapy. You may need to have some rehabilitation therapy so you can get some equipment to help you walk better or to help you adapt to what your body can and cannot do. Similarly, you can also do, again, some cognitive rehabilitation where you can really work on strategies to improve your memory, to improve your attention, and then again, use accommodations and use aids to help with those things. So again, if you have trouble remembering, setting up some sort of Google Assistant or Alexa reminders on your phone to remind you about things is one way to work around that. Other ways, other suggestions that we use are having patients use timers for different things. I think those are the major ways, but really in terms of the far-reaching effects, those don't have to be a thing as long as you can adapt and come up with these strategies to help you and help yourself. You don't necessarily have to have lifelong effects, but the lifelong effects would be that you need to use these strategies to help you along the way. So.
Okay. What is a transcranial Doppler and why is it important?
Great question. So a transcranial Doppler is an ultrasound. So an ultrasound study where they actually use the ultrasound probe and they put it on the base of your skull, basically, and they try to take a look at how fast blood is flowing in your large blood vessels in your brain. Transcranial Dopplers are recommended in the United States to be done in patients 2 to 16 years of age with SS and S beta null type sickle cell disease, because if you have, if the blood in your brain is above a certain rate, then that can put you at an increased risk for stroke. We would consider it imminent stroke if you have a very high, very abnormal transcranial Doppler velocity, very fast speed. Some patients have fast speeds, but they're not to the abnormal level. Those are conditional transcranial Dopplers. So they're a little bit lower, but they're still not normal, and they're still higher risk for stroke. Once we see patients who have abnormal transcranial Dopplers here, we usually put them on transfusion therapy or some sort of disease-modifying therapy if they can't do transfusions. And then we repeat the transcranial Dopplers and make sure they're coming down. Patients can also, with conditional transcranial Dopplers, usually get repeat transcranial Dopplers to make sure that it hasn't worsened or increased. And then again, we talk about disease-modifying therapies at that point in time with them.
Okay. All right. Okay. Renee has a hand up. So Renee, go ahead.
Hi, Dr. Lance. I know you said you don't treat adults, but I wanted to find out. I'm in my 30s, living with sickle cell disease, SS, and hydroxyurea has been working very well for me. Are there any physical signs as I get older that would hint at a silent infarct or similar stroke?
Good question. I can certainly answer questions about adults with the caveat that I don't treat adults. But in adults, I would say, so silent infarct in adults is still occurring in the frontal lobe of the brain. So the symptoms would be the same. What you might notice are difficulties with attention, difficulties with memory. So, you know, if you're in a meeting and you're kind of struggling to stay awake and you're finding that that's getting harder and harder for you than it has been in the past, that might be something that hints towards a silent cerebral infarct or a stroke. Having trouble remembering things is another thing. And these are things that can happen as we get older, certainly. But I'm talking about something that you were easily able to do before that changes over a short period of time. So, you know, all of a sudden you notice, oh, I'm having a lot of trouble remembering this, as opposed to kind of smaller, less obvious changes over time, although that can certainly be a thing. It usually is, honestly, it's something that people who are close to you point out. So when I am evaluating children with ADHD, a lot of times when I'm talking to the parents about the symptoms concerning for ADHD, the parent starts to diagnose themselves with something similar. Or the spouse will say, well, you know, my significant other definitely has this as well. What you're saying sounds exactly like them, not just as a child, but also as an adult. And so it's important to listen to, you know, if your significant other is saying, you know, this seems like it's getting worse, I really think you need to see someone for this. It's important to follow up on that. It's important to acknowledge that that might be a thing, and that's not just your spouse nagging you, as my husband would say to me. So great question. Did I answer your question?
Yes, yes. Thank you very much.
Yeah, absolutely.
All right. I'm gonna allow Karen to talk. Karen, go ahead. Yeah,
Karen.
Are you hearing me now?
Yes.
Okay, sorry. Good morning. Thank you, Dr. Lance. Following up from Renee's question, I am also a sickler, over 50. And I was wondering, are there any, let's say, supplements or other things like that that I can take to help with that memory loss? Because I have noticed that things that used to come quite easily for me, like remembering numbers at the click of a finger, it's not that easy anymore. So are there any kind of like supplements or so that I can take to help in the process? Or any suggestions you have?
Yeah, great question. So there are supplements out there that have been shown to boost memory and to kind of help with the attention and focus and all of those things. I am loath to suggest them specifically for you because I want you to talk to your doctor about that, because some of those supplements can actually interact with your other medications, right? So we know like ginkgo biloba, for example, is one that's quite commonly used out there, but it can have interactions medically with some of the other medications that you take. And so it may not be safe for you specifically to just take these things that other people are taking without having that conversation with your doctor. One thing that I would say I do not recommend to my patients is I would not use energy drinks or caffeine or other supplements. These are things that have such high amounts of caffeine that they can be harmful. And I really encourage my patients to try to cut on their caffeine intake, because a lot of people self-treat ADHD with caffeine, with cigarettes or other substances as well. And we really don't recommend that. So really only using regular amounts of these things is what would be best. In terms of, so again, I know there are a lot of supplements out there, and I really don't want to say the specific ones. What I would say is that there is a website. I use the NIH website. They have an alternative and complementary treatments website where they actually have research on these different things. And I use that for each of my patients when they come to me with a specific supplement they want to use. I look at that website and I find information about that supplement to see if there's any proof that it does what it says it does. And then I make sure that there's no interactions between the medications that they're on and everything else. And then the last thing that I do is, that a lot of people are selling supplements and things, and it's more of a money-making scheme, and it's not about your health. And those, so for some of the ones that I haven't heard of or that aren't by reputable companies, I sometimes go to the FDA website and look up the company, or the Better Business Bureau, and look up the company itself to see if there have been any concerns about the way that they practice or the claims that they make, or even just the manufacturing of the supplement. So I would basically say trust no one. If you hear about something that works for one person, discuss it with your doctor before giving it a try. If you're going to try it in small amounts first to see how it affects you, because you could be allergic to some of the ingredients for it, which means it could cause a very bad reaction, or again, it could interact with your medications. But I certainly know that some patients have tried supplements that really work for them. Things like multivitamins are certainly almost always okay to try and safe. And so I am more worried about the safety than the effectiveness. As long as you're giving it a safe and reasonable try and starting with a small amount and talking to your doctor first, you may be able to try these things. I'm sorry, I can't make more specific recommendations for you.
Sure. Shanice Ferdinand. Go ahead.
Hi, yeah. Hi, can you hear me properly?
Yes.
Right. So I have an 8-year-old daughter. She had a stroke back in 2019. So she was 5 at the time. And I've seen a drastic change in her behavior. She doesn't behave like the sweet, gentle child that she was before. She's a lot more naughty now. I wanted to find out if there's anything that you would recommend. I did take her to a psychologist, but we didn't get anything out of her to find out why her behavior changed. She was paralyzed on the entire right, so she still doesn't have use of her arm, and she walks a bit funny still because of the strokes. We did therapy with her. Because of COVID, we had to stop the therapy because of the risk for her. So I was just, my question is, what can I do to help with her behavior to bring her back to the person she was before?
Right. So that is a great question. I'm very sorry to hear that, especially that the therapies were stopped due to COVID. That's certainly very common right now. What I would say is, depending on the location of where her stroke occurred, you may be seeing some loss of inhibitory control. And so that means that the behaviors that you're seeing, she may be more impulsive and more reactive to things, because especially if the stroke occurred in the frontal lobe of the brain, that's where we are able to have that self-control and have that inhibitory control to keep us from saying or doing things impulsively or just reacting to things. So that may be part of what you're seeing in your child. Now, the injury happened young enough that certainly those brain pathways may be able to rebuild themselves. But in the meantime, you're going to want to try some behavioral strategies and possibly get some behavioral therapy on board for her. Behavioral strategies usually involve, so again, a lot of reminders, giving her some breaks if you see that she's getting frustrated in particular, because frustration can be driving a lot of this. You mentioned that she has some deficits, some difficulties with things. And so if things are harder for her, she may get frustrated, and that frustration may also lead to the behavioral difficulties as well. So I am not saying that she is not going to be able to do those things. I am just saying that when you see her getting frustrated, to take a break first, take a breath. So teaching her these strategies as well for herself, taking a break, taking a breath, and then trying again, trying it a different way, maybe something that helps with the frustration. Sometimes you may have to just go to a different thing entirely, and then come back to that particularly stressful or frustrating task that she's trying to do. And then again, working around the deficits in any way that you can to minimize frustration. It's also important to know that even therapy can be fatiguing for children. So when you stop seeing gains from the therapy, it may be time to take a therapy break, just like a summer break from therapy, just to give the body a chance to rest, to give the child time to be a child, time to play, and then kind of try to get back to it when they're in a better mindset and a better frame. You can always work on the exercises and things at home. There are also activities that you can do where you can work on things that the therapist is working on. Usually the therapist will recommend some stretches or some activities. I have a lot of kids that may do swimming as a therapy. Horseback riding can be a therapeutic intervention if they can tolerate it. Taekwondo or martial arts, absolutely. Yoga. And these are all things that you can find videos for on YouTube. I know I'm missing some things. Music is definitely, music therapy is something that's been effective for a lot of patients of mine. And I also want to say for the older age group that things that can help your brain in terms of getting older but training your brain are learning a new musical instrument, learning a new language, things that really push your brain to develop the existing pathways and to stretch and to reach can really be good for you as well. But for this child in particular, I would say behavioral therapy and then kind of reinforcement. So making sure you give that positive reinforcement whenever she's doing something right, give that positive reinforcement right away, immediately, taking those breaks when you see that she's getting frustrated, redirecting to something else if you need to, and then giving rewards, possibly even keeping a behavior chart where she gets that constant reinforcement and can look up and see the chart regularly and see that she's behaved, correctly this many times this week and might be eligible for a reward at some point. Those are the strategies I would suggest.
Okay, how is a transcranial Doppler different from an MRI?
Great question. So an MRI is looking at the structures themselves, so the anatomy of the brain. It's looking at the brain structures. It's looking at your cerebral spinal fluid, so your spinal fluid. It's also, it can also look at your blood flow. You can use it to look at the direction of the blood flow in the brain, but it is not as good as picking up like the velocity of the brain. So it's basically just two different techniques to look at imaging. The MRI, you kind of get into a large machine. It makes a lot of thudding noises and is very loud. It can take about 20 minutes to scan your whole brain, but you're really getting a look at all of the different structures in the brain. The ultrasound can look at the structures, but the resolution is not as good as an MRI. It is definitely less noisy than an MRI and easier to do. But the ultrasounds are more difficult to do in adults because basically your bone development is such that after 16, it can be more difficult to reliably see the vessels or the structures in the brain. In babies, we actually do ultrasounds of the brain using the open fontanelle at the top of the head, and that allows us to get a really good look at the structure of the brain. We can look for bleeding and other things. It's really quite easy at that location and at that level. But once the fontanelle closes, we only have these other windows in the back of the head, and they are not as good. They really take a person with skill and training to do them correctly. And so that's not available everywhere. The machines themselves are not available everywhere, and someone with the skill and the training to do it are also not available everywhere.
Okay. How is it important? How important is it that adult patients with a history of stroke do regular transcranial Doppler screening?
So there is not research suggesting that adults get transcranial Dopplers. Again, that bony window closes in adults after 16 or 18 or so, and so it's not something that we regularly do in adults. There have been studies showing that it's possible to do it, and that we might want to consider it if we don't have other means. You know, if some patients can't tolerate MRI, that is something to consider. But again, it's not available everywhere. And without having like norms for adults, it may not be something that's useful at all to do in adults or in patients with other types of sickle cell disease, like SC disease or S beta plus thalassemia. We don't have normal values for transcranial Dopplers in those populations. And so it's hard to take the data from the transcranial Doppler and apply it to those populations at this time.
Okay, in your presentation, you mentioned that you have a neuropsychologist assisting you in treating your patients. So have you found that mental health is important in treating persons with sickle cell, especially those who have suffered neurological issues?
Yes, I have. So that's a great question, very timely. So the clinic started when I was a trainee. I was interested in learning more about people with sickle cell disease and was allowed to see patients in my clinic as a resident, actually, in training in Baltimore, with supervision, obviously. When I graduated, we formed the clinic, and at first I was seeing the patients by myself, but I was finding that I was doing a lot of referrals for these patients to the neuropsychologist for cognitive testing and mood testing, and also to behavioral therapy. Specifically for behavioral therapy services, for behavioral issues, but also for mood issues as well. Mental health disorders are certainly more common in sickle cell disease, much more common. And part of that is due to the nature of having a chronic disease. So having a chronic disease itself can be very hard. A lot of people can struggle with that. And so our behavioral therapist really works with children on coping strategies to deal with the fact that they are different than other children and may have to do things differently than other children, like swimming in cold weather, for example. So really helping them cope with that, adjust to that, coming up with strategies for them to explain what sickle cell disease is or why they have to do things differently or why they sometimes miss school can be very important to do to normalize things for these kids at a young age. And also, again, to help them reach their full potential, because we don't want to limit anyone. We want them to be able to be safe and take care of themselves and be educated, but we don't want to limit them as much as possible. So a few years ago, we all joined forces because we were all seeing the same patients and referring the same patients. And so now we have a comprehensive clinic where each patient in the comprehensive clinic is seen by myself, the neurologist and developmental pediatrician, the neuropsychologist, Dr. Cannon, to get cognitive testing, and the behavioral therapist, Bridget Gibbons. We actually have the clinic twice a month now via telehealth due to COVID, so we can still see the same number of patients. And we just had it this morning, actually. It's Wednesday mornings. And so I had just finished with patients when I joined you guys. It's allowed us to have a broader reach, seeing patients from some of the further places in Maryland. We also have seen patients in DC and Virginia who would normally come in person. And so we really are trying to provide that standard of care for everyone that we can.
Okay, great. I think Keely has a couple questions. Keely?
Yeah, hi, good afternoon, everyone. Welcome, Dr. Lance. I have a few questions for you. I have a daughter who is 10 years old now, and she experienced a stroke at the age of 4. So my first question would be, while she was actually having the stroke, I noticed something was not right and she was not being very responsive. And she was lying down on her left side, if I remember correctly, and I changed her position. Now, at the time, like I didn't realize what was going on. I just realized that she was not responsive. And in changing her position, she became responsive, but I noticed the effects of it the other day, the next day, sorry, where she was drooping on I think it was the left side, right, and her hand was not able to go up, and that's when I took her to the hospital. So my first question is that is a change in position when it's actually happening, does that make a difference in terms of the impact of the stroke?
All right, so good question. I would usually say no, it does not, just in terms of moving from one side to the other. If the stroke is happening, it is happening, and changing position doesn't necessarily help. However, sometimes in the hospital, once we've diagnosed that a stroke may be happening, we may position the patient in a certain way to maximize, I guess, blood flow to the brain. But that is not something that I would do outside of a hospital setting, because there are different types of stroke, some of which more blood flow to the brain can be harmful for. So you can have a hemorrhagic stroke, which is more of a bleeding stroke. And that is something that is more common in like 20-year-olds with sickle cell disease. I think that's when the highest risk of that is. And then there's the more common type of stroke, which is the ischemic stroke. And that's where you're not getting enough blood flow to the brain. And that's what's more common in younger and older patients with sickle cell disease. So in the hospital, once we have assessed patients and can see that they're having a stroke, we may essentially adjust their head position so that we are maximizing blood flow to the brain via gravity, but that is not something I would recommend outside of the hospital unless your doctor recommends it. It's very hard to diagnose stroke in children, even when they present to the hospital, because it's so rare, it gets missed. And so it's important to know that this is something that's increased in children with sickle cell disease, and to notify whoever's evaluating your child that your child has sickle cell disease and you're concerned that they're having a stroke. So parent education, parent advocacy can really be an important key to getting them diagnosed faster and getting them the treatment that they need.
Okay,
So my other, sorry, go ahead. My other question would be, well, for her, she did not have a lot of residual effects from it. I think she had temporary paralysis on her left side, and that was repaired with therapy. The only thing I noticed though is that she was left-handed and now she's ambidextrous. So because she was not able to write with the left hand, she started writing with the right hand, and the right hand is now her stronger hand. And now she switches between hands, right? And the other thing, well, I started doing is, getting her involved in music and language, and I definitely see the difference with her. And then my last question would be, would an oxygen machine when she's sleeping help with that oxygen to the blood? Because I know you spoke about that earlier. And is that something that you would recommend that people get?
Hold on one second. I can hear my father in the background. Hold on. Okay, sorry. So definitely glad that she is getting the music therapy and doing the language. You also may want to consider some sports for her. Being ambidextrous, there's no problems with that. It can actually be a benefit in certain sports as well. So that may be something to work on her coordination. If your doctor recommends that oxygen overnight, then that is something that I would definitely follow as a recommendation for sure. So if that's something recommended by your doctor, you should definitely do that, because as you saw from the slides, oxygen overnight can certainly affect the brain.
Thank you.
Yes, absolutely.
No, I know we're almost done here, so I'll just pose 2 more questions I will pose, and we'll wrap up. So the first is, Dr. Lance, can the brain regenerate? Some have reported yes with aggressive plant-based whole foods. And the other question,
Oh, go ahead.
the other question is, are personality changes common after suffering a stroke?
So the brain, in younger children, the brain can regenerate. It can grow new pathways around the injured area. We don't always see repair of the injured area, but really the brain just grows new pathways around the scarring. I cannot recommend plant-based or herbal supplements for the reasons that I said before. And then what was the second question one more time?
Are personality changes common in persons who have suffered stroke?
Yes, personality changes can happen in anyone who has suffered stroke, particularly if the stroke happens in the frontal lobe of the brain. It can be rather abrupt. In addition, depression is actually more common in adults with stroke. And so you want to make sure that they're getting the therapy that they need, because the personality changes that you're seeing may be due to depression as well.
Okay, so before I ask Keely to close, I'll just ask one more question. Is there any specific reason why the frontal lobe is so affected by sickle cell disease?
That's a great question. I don't have a good answer for that. It just seems like it's targeted. It may be that those blood vessels are more susceptible to inflammation. And it may also, well, it really is that the areas of the brain that are targeted are the areas in between vessels. So they're called watershed areas where, you know, the blood flow gets to these areas and then it kind of spreads out from there. And it's these areas that are furthest away from the separate blood supplies that aren't getting as much that are very heavily targeted. So that is mostly frontal lobe, but there are also areas in other parts of the brain, the parietal lobe, the central parts of the brain that can be affected by it as well. So that's how I would explain it.
Okay, so Keely, you can go ahead. Keely, Heron.
Hi, everyone. On behalf of this society, Dr. Lance, we just want to thank you for, your joining us here today and for the knowledge that you've imparted. I'm sure that the information you provided was very, very helpful to persons on the panel as well as attendees, and especially in bringing some clarity to neurological disorders as a result of sickle cell disease. This information is, something that we don't have a lot of access to, as well as the research. So, if you in the future want to do some research in Trinidad, I think that could be a very good and beneficial thing for everybody here. But thanks again. It was definitely a pleasure and honor to have you here with us today.
Yes, thank you again for the invitation. And sorry I have to leave so abruptly, but I appreciate you guys' time and great questions today. Thanks.
Well, I just want to say a very special thank you, because I know you were so willing and you came at short notice. All right, so thank you very much.
Of course, absolutely. Thank you. Bye.
Thank you, everyone.
Thanks.